If you want awesome products at great prices, check out the in the description. The Silent Struggle: Scotland's Failing Abortion Access and the Untold Journeys of Vulnerable Women. Scotland, a nation often lauded for its progressive social policies, is grappling with a stark and unsettling reality: a systemic failure in providing timely and accessible later-term abortion services. The consequences are deeply troubling, forcing extremely vulnerable women to embark on arduous, expensive, and emotionally draining journeys of hundreds of miles to English clinics, simply to access healthcare that should be readily available within their own borders. This isn't a matter of abstract statistics. It's a crisis impacting real lives, impacting women already facing immense challenges, often compounded by complex medical circumstances or personal vulnerabilities. The numbers speak for themselves. A significant increase in Scottish women seeking later-term abortions at English BPAS, British Pregnancy Advisory Service, clinics, 88 in 2024, up from 67 the previous year, paints a grim picture of a healthcare system failing its most vulnerable citizens. This isn't merely an inconvenience, it's a violation of fundamental human rights. For these women, the journey isn't just geographical. It's a harrowing emotional and logistical obstacle course. Imagine the added stress of travel, accommodation, potentially child care arrangements, and the financial burden of such a journey, all while navigating the emotional turmoil already inherent in such a difficult decision. The root of this problem is far deeper than mere logistical challenges. Campaigners, including those at the forefront of the fight for reproductive rights, point to a pervasive stigma surrounding later-term abortions within the NHS. Managers, critics allege, are often hesitant to provide the service, citing vaguely defined social reasons rather than medically justifiable grounds. This subjective interpretation of medical necessity creates a discriminatory barrier to access, effectively denying women the care they need and forcing them to seek help elsewhere. This is not about a difference of opinion on the morality of abortion. It's about access to legal, medically necessary health care. The Scottish government's response to this escalating crisis has been woefully inadequate. A Freedom of Information request revealed the uncomfortable truth: NHS Scotland has internally acknowledged an explicit inequality in service provision. This is not simply a bureaucratic oversight, it's a blatant admission of failure. The silence from government officials is deafening. The stark reality is that the Scottish government has a clear legal and moral obligation to rectify this situation. As one campaigner powerfully stated, if the NHS can't provide this service, then the Scottish government has a legal and moral obligation to find another provider. This isn't a suggestion, it's a fundamental requirement of a just and equitable healthcare system. Failing to act is a dereliction of duty with far-reaching consequences. This isn't merely a healthcare issue, it's a human rights violation, disproportionately affecting the most vulnerable women in society. The added burden of travel, financial strain, and emotional distress is unacceptable. The current system is not only inefficient, but also actively discriminatory. The financial and emotional costs are borne disproportionately by those least able to bear them. The situation is further complicated by the ongoing presence of anti-abortion campaigners, funded by groups like the Texas-based 40 Days for Life. Their activities, though ostensibly contained by newly introduced buffer zones around sexual health clinics, still cast a shadow of intimidation and harassment over women seeking vital health care. The recent arrest of a protester who allegedly breached a buffer zone underscores the persistent challenges in ensuring safe access to services. The spread of misinformation, like that from U.S. Vice President J.D. Vance regarding Scotland's abortion regulations, only serves to exacerbate the situation. The silence surrounding this issue is deafening. The Scottish government's inaction is not only a moral failing, but also a legal one. The evidence is clear. A significant number of vulnerable women are being denied timely and accessible health care within their own nation. The government's failure to address this systematic inequality is unacceptable and demands immediate action. The time for empty promises and bureaucratic inertia is over. Scottish women deserve better. They deserve access to comprehensive reproductive health care, free from stigma, harassment, and the impossible burden of long and arduous journeys for essential care. The moral imperative and the legal responsibility lies squarely with the Scottish government to address this crisis with the urgency and compassion it demands. The stories of these women, forced to travel hundreds of miles in search of basic health care, should serve as a wake-up call, a powerful testament to the urgent need for change. Their silence must be broken, their voices amplified, and their needs met with the urgency and respect they deserve. The long, stressful journeys undertaken by these women, the financial burden they carry, and the emotional toll they endure must be acknowledged and addressed with concrete action. The time for action is now.